Eligibility criteria ensure the donor is between 18 to 60 years of age, is in good physical health, has had at least 8 hours of sleep, possesses a valid national identity card, physical examination. Conduct a brief physical assessment to confirm fitness for donation. Token issuance. Upon successful completion of the screening, issue a donation token to proceed with the next step. Donor demographics. Donor demographics refer to the basic personal and background information collected from each blood donor during registration. This information is crucial for donor identification, traceability, communication, and for maintaining accurate records in compliance with quality and regulatory standards. Donor demographic details include full name, age and date of birth, gender, national identity number, contact information, phone number, address, email, donation history, first-time or repeat donor, occupation, clinical and operational importance, ensures unique donor identification and traceability, enables follow-up in case of abnormal results or TTI positivity, helps in data analysis for donor recruitment, deferral trends and planning, required for regulatory compliance and audit trails, medical history evaluation. In the history room, a detailed medical history is taken to ensure there is no behavioral or medical risk for transmissible infections, for example, hepatitis, HIV. The donor has no underlying conditions that could pose a risk to their own health, either temporarily, for example, recent illness medications, or permanently, for example, chronic diseases, high-risk behavior. Importance: prevents transmission of infections, avoids adverse donor reactions, maintains safety of blood products. Vital signs assessment. The donor proceeds to vital sign monitoring to ensure they meet physiological criteria. Body temperature, blood pressure, pulse rate, hemoglobin level. All values must fall within the recommended range. Donors who do not meet these criteria are temporarily deferred and advised accordingly. After the donor is registered and cleared for donation, a donor identification number is generated and assigned. This unique code is used to match the donor with all associated materials and records throughout the donation process. The donor is then directed to blood collection area.
Collection, the staff must scan the DIN barcode. The system will verify the DIN against the donor's digital record to confirm the correct donor-to-bag match, ensure traceability and data accuracy, prevent errors or mix-ups. Significance: ensures patient safety and data integrity, supports electronic traceability and inventory management, complies with quality standards and regulatory requirements. DIN labeling procedure. The DIN is affixed to the triple blood bag set used for blood component preparation, 3 sample tubes designated for TTI transfusion transmissible infections, screening, serological testing including blood grouping, blood bag preparation. A new sterile blood bag is selected. The bag is carefully labeled with the assigned DIN prior to collection. The same DIN must match all accompanying sample tubes and documentation to prevent identification errors. This step is critical to maintaining the chain of identity and ensuring the safety and quality of blood components. The blood bag is placed on the biomixer to monitor the volume and ensure proper mixing with anticoagulant.
Venipuncture site preparation. Apply a tourniquet and palpate to
Select a suitable vein. Perform aseptic skin preparation. Clean the site with 70% isopropyl alcohol downward stroke and allow to dry. Follow with 10% povidone applied in concentric circles from center outward. Allow to dry for at least 30 seconds. Venipuncture and collection. Perform venipuncture and start collection. After collecting the required volume, release the tourniquet. Remove the needle. Cap the needle using the one-hand technique. Place collected blood on the sampling counter. Sampling and sealing. Collect blood samples in designated tubes for TTI transfusion transmissible infections, testing, a BO and RH blood grouping. Use a tube sealer tool. Seal the tubing after sampling. Discard the used needle safely. Strip the tubing to ensure the blood mixes evenly with anticoagulant. Segment preparation. Prepare segments from the tubing to be used for blood group reconfirmation, cross-matching and compatibility testing. Place the labeled blood bag, along with its corresponding sample tubes, into a designated sterile transportation container. Ensure the container is securely closed to maintain sterility and prevent damage or contamination during transfer. Transfer to processing area. Transport the container to the component preparation area, processing room, without delay. Importance of proper handling and timely transport. Maintains the quality and viability of blood components. Ensures accurate traceability and record keeping. Supports efficient and safe component preparation. Component separation. In the processing area and under controlled conditions, the collected whole blood is separated into red blood cells